Be aware that we do record this and it'll be subtitled and available within a week. Maybe a slight longer delay with the Easter holidays, but it will be published shortly. We will take questions if you wouldn't mind putting them in the chat, and we'll deal with those at the end. Usual rules apply. If you wouldn't mind staying on mute just while our guest speakers are doing their presentations. So today we're here just to discuss HSC apps. If you're anything like me, I'm sure your phones got lots of apps on them. And during COVID in particular, the DHCN team, as well as some of our HSC colleagues, all produced a raft of apps to help us sort of deliver services and manage our own lives slightly differently. And we partnered with ORCHA to help us with that work. So they're here today just to give us an idea of what's next and how we might develop apps and what the future might look like. So I'll hand over to Sue in the first instance, and she can introduce our colleagues. Thanks, Sue.
Good morning, good afternoon, everybody. My name is Suhan. I am the Innovation Lead for Digital Health and Care at Northern Ireland. Please excuse me, I'm in a public place because I'm actually traveling at the moment. So if you hear any background noise or things crashing, it's not that I'm in the kitchen and I'm breaking everything. It's just things are happening around me. So I'm delighted here today to introduce Fiona Costello from ORCHA. As some of you may be aware, during the pandemic, we were asked to set up a HSC apps library, which I would, if you're not familiar with it, I would put the link on the chat later on. But the HSC apps library was in response to the pandemic, and what we were trying to do was to really give people a range of apps that they could help themselves, especially during the early stages of the lockdown, to help themselves either to look for information, to actually use with their patients, with their service users. So there's a range of apps that we put available, and at the time, that was something that was safe to be a need. 3 years on now, things have moved on quite a lot, and our apps library is now due for renewal. So I've invited Fiona today to come and share with us a bit of what's happening in this particular app space. And some of you may know that there is obviously lots of apps that we used during the pandemic, but there might be more things that are happening. So I'll pass it over to Fiona to introduce herself, because I think there's probably a very bad echo where I am. So I'll hand over to Fiona. Fiona, over to you.
Good afternoon, everyone. Thank you, Sue, for the introduction, and thank you, Linda. As Sue said, my name is Fiona Costello, and I'm from ORCHA. For those of you who don't know ORCHA, that stands for the Organisation for the Review of Care and Health Apps. And my role at ORCHA is Senior Vice President of National Accreditations. What that means in English is that my primary role is to work with governments and regulatory bodies and policymakers to support their thinking around digital health assessment schemes. So that's about how we support our digital health suppliers to navigate this emerging digital health infrastructure, with giving particular focus in regard to compliance against a variety of different assessment scheme components. That includes taking into account medical device regulation, but it also takes into account additional criteria. So some of you may be familiar with the NHS Digital Technology Assessment Criteria, which ORCHA independently assess products against. But we also build enhanced assessment criteria. So my role is really focusing on that, as well as supporting our digital health suppliers to navigate this emerging digital health infrastructure, and supporting them in understanding what regulations apply to them and where and when. So I've prepared some slides. I'm really delighted to be here today to talk a little bit about the future of digital health and its role in supporting healthcare systems to respond to systemic challenges we're facing, particularly with regards to demand management, capacity planning, resource optimization, and really thinking about how we can use digital to support a transition to more prevention-focused services to sort of relieve that burden on our traditional healthcare services. So bear with me a moment while I just share my screen, and then we can properly get started. So the brief for today's session was to talk about transforming healthcare. Transforming healthcare with digital health apps. What does the future look like? And in that regard, it's kind of really understanding what the digital health opportunity is. So there is demand for digital health from the population. So certainly, as Linda said at the very beginning, lots of us have different apps. I've got about 5 health and fitness apps in a desperate bid to control my weight. But lots of people do various different things with their healthcare apps. And we know that because of that demand from the population, policymakers and professionals are equally increasingly starting to look at the ways in which they can harness that power of digital health to truly support their patients and citizens, and equally how the industry is responding to that demand. So the supply from clinical entrepreneurs and digital health suppliers. So we know that roughly there are 5 million downloads every day of digital health and care apps. We know that 93% of clinicians believe that digital technologies can help. There is a wide variety of digital health apps available on the market, around 350,000 apps. And I think the statistic is something like 300 apps coming onto the marketplace every day. And by apps, we mean apps that you can access on your mobile phone or web-based app platforms, but also apps that are linked to physical devices. And we also know that the result of some of these digital health interventions is that there are opportunities for the digital health to save the NHS up to about £500 million annually in various different mechanisms, which I'll come on to throughout this course of this presentation. So in terms of digital health capabilities, it's really amazing what is possible using the phone that's in 7.33 billion pockets. I think there are more digital phones in the marketplace than there are toothbrushes, which is really a staggering statistic. But in terms of those capabilities, we've got, for example, a smart asthma device, which you blow to get peak flow, which is smaller and easier to use than traditional peak flow monitors. You've got Cardio as an example, which is a heart rhythm detector. You use your fingerprint to get an accurate ECG, which means no wires, no hospital visits. Another example is Flowly, a wireless VR headset and heart sensor, which provides immersive biofeedback, which relieves pain, anxiety, and insomnia. And you also have an example of a product called Reflex, so wireless 3D motion detection straps that give live feedback and relieve pain via an at-home digital physiotherapist. So there are numerous ways in which we're harnessing developments in technology to really help patients at home control and manage their conditions. In terms of professional engagement, as I said at the beginning, 93% of policymakers and health and care professionals support digital health. 80% of professionals themselves are using smartphones and likely to use medical apps. 40% believe that health technologies can reduce the number of visits to the GP. NICE recommend digital health across health areas, including behaviour change, mental health, and in the management of long-term effects of COVID-19. You will know that NICE increasingly have been putting out various different announcements with regards to this genuine movement towards the use of digital health in pathways. And certainly from an NHS England perspective, with regards to the NHS digital technology assessment criteria, one of their key drivers for doing the DTAC audit across all healthcare systems in England was really to identify those digital health products that had been implemented at scale, and then being able to think about how those products or how that form of technology could then be embedded within the NICE recommendations for pathways and service design. So it's really starting to take that holistic approach rather than just the kind of the ad hoc use of digital health products that we were seeing prior to the pandemic, but were certainly accelerated as a result of the pandemic. And similarly, the World Health Organization is an advocate for digital health, and its G20 digital health report. And one of the reasons is to reduce pressure. So introducing safe and effective digital health can reduce pressure on health and care systems. So this is in relation to the £553 million opportunity for cost savings. That is based on just 4 areas: MSK, long-term conditions, frailty amongst the elderly, and mental health. Digital health, when it's used correctly, can prevent annual attendances in general practice, ambulance journeys, A&E, and unplanned admissions, which allows that creation of capacity to allow more surgical procedures in secondary care, and then equally its use is the equivalent of up to 590 more GPs. For those of you who are interested in that health economic analysis, I can share it after today's session in consultation with our Director of Research and Chief Operating Officer. These avoided attendances would save the NHS around £500 million annually, and these figures were presented as part of when our Chief Executive went to the Health and Care Select Committee in January. So to just take that at a bit of a more of a micro level, so for example, elective recovery. So we know, for example, that in England, there are currently 7.19 million people who are waiting for routine operations such as a hip or knee replacement surgery. We also know that whilst on that waiting list, with an increasing number of those moving over, what was genuinely a never event, but increasingly is becoming more and more common, of 52-week waits, for example, that those patients can experience worsening pain, reduced mobility, the stress of the wait, particularly with regards to those who are in pain, sleep challenges, and do not take steps to stop smoking or reduce alcohol intake. So that obviously has an effect in terms of their readiness for surgery and the potential impact in terms of cancellations because they're not fit, which again compounds the demand and capacity issues facing the NHS. It leads to deteriorating health and further attendances at GP practices and A&E because they're looking for help in between various different outpatient appointments, but then also in the run-up to their surgery. And it can also lead to more complications in surgery, a longer length of stay in hospital, and higher chance of readmission. And then it's about thinking about that post-operative discharge. So patients typically receive paper physiotherapy plans, which can be hard to follow or stick with. And this is an example of Frances, who's 65. She's been waiting for 18 weeks. The likelihood of her being a health app advocate is 58%. 42% is she's already using a health app. 77% she's finding a health app helpful, and 4% she's being recommended a health app by a clinician. This means that largely she's looking for that support herself and independently of the health service. Now, in addition to putting that burden onto the patient and them having to navigate this massive 350,000 digital health technologies, you as a healthcare professional can't be sure that what Frances is using is actually correct and that she's potentially using the best technology that's available. But the impact of using that health app is that it can help her to manage pain and stress. It can help her to improve surgery readiness by losing 2.5 stone and stop smoking, which will improve blood circulation and lung health by 10%. So in terms of how these digital health apps can be used in the different stages of a pathway, it can be used at the point of waiting, so pain management, stress, help with sleep. It can be used, as I said, with pre-surgery optimization, so thinking about her weight management, stopping smoking or reducing smoking, similarly with alcohol reduction, and then post-surgery with physiotherapy and occupational therapy. And we know that if you take physiotherapy, for example, that a digital health app can support that compliance between appointments to basically optimize her recovery and therefore potentially to reduce the onward burden on healthcare systems. So introducing safe and effective digital health for long-term conditions can reduce pressure on the NHS and prevent annual attendances, as I said, and then using the digital health to deliver these gains, again, £500 million. We know that the President of the British Orthopaedic Association said prolonged waiting has a significant impact on patients' mental and physical health. Patients in severe pain lose mobility and independence, their health deteriorates, they are unable to work, require more GP support, and increasingly rely on stronger and stronger painkillers. So there's lots of ways in which digital health apps can support those challenges that have been identified there. Similarly, health apps can be used to support the workforce. So prevalence and impact of poor mental health. This leaves no profession unaffected. We can all throughout our lifetime are likely to experience some kind of mental health condition where we might have low to moderate anxiety, for example. So in England, 25% of people experience poor mental health in England in any given year. That's 1 in 4. And 13.9 million of people are affected. That's more than the population of Scotland, Wales, and Northern Ireland combined. And we can see that the impact and the prevalence of mental health is most severe amongst teachers and nurses, with also doctors and armed forces impacted. The prevalence is rising. We all know the prevalence is rising, exacerbated again by the pandemic, and there's been a clash between the demand and supply. So mental health is the second largest cause of morbidity in England. It's responsible for 72 million working days lost, which again has an impact on the overall economy, costing £34.9 billion per year. People with a long-term mental health condition are twice as likely to lose their job, with 300,000 doing so every year. That's equivalent to the population of Newcastle or Belfast. And 70 to 75% of people with diagnosable mental illness receive no treatment at all. So it's really about filling those gaps in provision that can then have a demonstrable impact on the healthcare service overall. So from a mental health perspective, where does digital fit in? We can use education information to wait for an assessment. Waiting list for IAPT, you can use digital health technologies to support with coping management. IAPT obviously being psychological therapies or talking therapy services. My background is that I came from a digital mental health product. And when, in addition to being used as a replacement for the depression protocol, for example, mapped to the NICE protocol, we also over time use the product as an adjunct to face-to-face treatment, again, supporting that compliance. It can be used for commensurate treatment and continuity of care. So for this particular mental health app that I worked for, provided an online coaching service. So they worked through evidence-based content, and then with the support of a psychological therapist who would then be there to respond and review their progress against the program. And then finally, with completing the treatment, they were then able to revisit various different aspects that they would bookmark throughout their use of the app. So that could be a mood monitor or various different coping strategies, for example, a worry tree. They could revisit some of those techniques and ways in which to manage their stress to then potentially support and optimize their well-being after they've had that intervention with the healthcare service. This is particularly relevant for those who are kind of revolving door and who are sort of feeling well for a period of time, but then slip back into old habits and slip back into that sort of, you know, things like rumination, for example. So the benefits of digital health, so as I've said throughout, so doctors and healthcare workers can only see one patient at a time, and this is getting harder. If you have ever heard our chief exec, Liz Ashell-Payne, speak, you'll have heard her talk about one of the reasons why she founded ORCHA in the first place was that she became really aware of the personal constraints of her personal capacity. So thinking about the fact while she could only see one per hour or one per every 20 minutes or 40 minutes, digital would allow her to reach a far greater audience. So she was really impacted by that and wanting to think about how can we really harness the benefits of digital to improve capacity. And this is particularly relevant at a time when the healthcare service, in addition to some of the pressures around demand, capacity, workforce optimization, we've got an aging population. This is also compounded by the increased expectations of healthcare professionals by that population, whilst also lifestyle factors leading to increased morbidity. So the benefits of digital, you could treat 10,000 patients at the same time with the right health app. So health apps for mental health, they can be used to support postnatal depression, anxiety, OCD, schizophrenia, stress, suicidal thoughts. In the context of elective recovery, pain management, sleep support, stress and anxiety, fitness and weight loss, and that sort of post-surgical discharge period with physio and occupational therapy, for example. And I think, and it's not just us that are saying this as ORCHA. As I said, the National Institute of Clinical Excellence has been making increasing strides in advocating the use of digital health in a controlled way, but in a way where there is clear evidence base to support it. So, for example, last May, NICE recommended Sleepio as an effective alternative to sleeping pills, which would save the NHS money as well as reducing prescriptions of medication, such as Zolpidem and Zopiclone, that can be dependency forming. The economic analysis found that healthcare costs were lower at 1 year when using Sleepio, mostly because of fewer GP appointments and sleeping pills prescribed. So all of the information that I've just provided to you is then enabled and supported by that national view. And that's why they're placing so much emphasis on digital interventions. They recently said that digital interventions could be used in the form of treatment with children and young people for mental health services. And they're also announcing various different evidence-based interventions that will be incorporated in the pathway, and thinking about real-world evidence versus, your traditional clinical trials, which can hamper innovation at times. But despite all of that, and one of the reasons why we did the library in the first place is that yet only 21% of the public have been recommended a digital health tool by a health or care provider. So why, with all of that evidence, with all of that potential, with all of that capability in the market, why haven't we yet seen wholesale adoption across health and care? and how do we overcome these problems? At ORCHA, we strongly believe that when we think about digital healthcare, we have to learn from other parts of healthcare. You would never take a drug that hadn't been through a process and recommend it to a patient. You would never grab a person off the street and put them in a clinic and say, off you go, you can treat. And yet there is this tendency that we don't quite regard digital health in the same way. We at ORCHA are fierce advocates for the importance of establishing the quality assurance procedures that have long been followed by other areas of medical practice. And with that, we mean awareness, trust, access, and governance. So if, for example, you take that medication journey, the British National Formulary lists approved drugs and training and prescribing for professionals. MHRA approves and licenses drugs and NICE assesses the impact and effectiveness. You have e-prescribing to distribute and track medicines, and you have prescription drug monitoring programs and DATEX for untoward events. It's this exact approach that we think needs to be implemented for digital health in order to harness those capabilities. But it's not just about an assessment standard. It's not just about, so for example, the ORCHA baseline review or the NHS digital technology assessment criteria just being a standard that exists. It's about that systematic approach to the deployment of that standard to really unlock the power of digital health. So I'm just going to talk a little bit now about what ORCHA do specifically and how we have developed as an organisation to provide the core infrastructure to introduce digital health safely. So we have three core elements of our offer. There's ORCHA Assure, which is our cloud-based digital health assessment platform, which allows assessment teams to conduct accurate reviews of digital health technologies at scale and at pace. So with ORCHA, that might be taking a product through the ORCHA baseline review. The ORCHA baseline review is a foundation level assessment that assesses a product against usability and accessibility, professional assurance, data privacy and security. And because it's informed by an adapted version of the NICE evidence standards framework for digital technologies, it means that we can take a proportionate approach to the assessment of that digital health technology product. So in this regard, it allows us to distinguish between a digitized patient leaflet, for example, versus a digital diagnostic therapeutic where the clinical risk is that bit greater. In addition to helping healthcare systems to navigate that difference and to navigate that proportional risk assessment, it also allows us to provide that help and support to digital health suppliers and clinical entrepreneurs themselves. So it helps us to identify where your product, if you are an innovator or an entrepreneur and you've created a product, it allows us to identify where that product fits in, and take you through due regards. So for example, we know if a product needs to get CE marking, but we also know that CE marking isn't just enough. So in addition to taking a product through the ORCHA baseline review and taking that weighted approach to scoring, which culminates in an overall score against our pass threshold of 65%, it also allows incremental progress towards national assessment schemes. So the one that comes to mind most relevant to this conversation is currently the NHS digital technology assessment criteria. And in our experience, we know that if a product isn't passing the ORCHA baseline review, it's unlikely to be ready to pass the NHS DTAC. So that's the ORCHA Assure component. That ORCHA assurance process powers our libraries. So it's not just a collection of apps. What you're buying is what you're using, what you're benefiting from is a library that's constantly powered by that quality assurance process. Our reviews are updated on a continuous basis in compliance with the latest app updates and upgrades. We did a sample study of 60 products, and in those 60 products, between 2 and 9 updates and upgrades were recorded per year. This is where it's really different to drugs. If you think about that scale and pace, and then compounded by the scale and pace of technology in general. So obviously AI, machine learning, virtual reality, it's really important that you have a very flexible and agile infrastructure to be able to give healthcare professionals the confidence to make those recommendations. ORCHA Activate provides you with the infrastructure to enable the awareness, distribution, and activation tools so you can search for, find, distribute, and govern digital health in a coordinated, safe way. So this is our health app libraries and our health app formularies. And there is a video now that I'll take you on which distinguishes between the two. And then finally, our ORCHA Insight services. So ORCHA continually scan the digital health technology market on a global basis and hold the world's largest live database of compliance data to produce unique insight reports or dashboards. So for example, last autumn, we completed a women's health report that was showcasing a number of technologies, the changes in how technology were responding to the women's health strategy, for example, and vision. I'm really, really hoping that this video works, and then it also gives you a break from having to listen to my voice.
Digital health has the power to revolutionize the way we treat patients and service users, but that revolution comes at a risk. There are over 350,000 health apps out there on the market right now, and only 20% of them meet safety standards. ORCHA's suite of products offer the core end-to-end infrastructure needed for health and care organizations to safely deploy digital health into their services. Our products, co-designed with health and care professionals, help you to achieve the activation, adoption, and digital transformation you need. Today, I'm going to walk you through two of our activation products: our digital health formulary for health and care professionals, and also our health app library for patients and service users. The digital health formulary provides a single source for your health and care professionals to find the best solution from a set of digital health tools. This set is curated by your organization's standards from the thousands of apps continually assessed by ORCHA. These include consumer-friendly apps and those that require the guidance of a health or care professional. From the formulary, professionals can accurately recommend digital tools to patients and service users via text or email, ensuring the governance needed for risk management. There are two routes that professionals can take to find a tool from the formulary. Firstly, by topic. Topics are short lists of apps created by your organization's project teams for a specific health category. They make it easier for professionals to find the best apps for a certain area. Secondly, apps can also be found using the intelligent search bar and then filtered down to find the best results. There is a clear written description against each app within the digital health formulary, along with details of how the app performed in its assessments and whether it specifically passed any particular assessments, such as DTAC. Communication when it comes to health apps needs to be clear and monitored. A verbal recommendation might be forgotten, and a paper note might be lost and can't be issued in a remote consultation. Through digital health formulary, health and care professionals can send a recommendation by text or email, and this is then tracked, giving peace of mind to you and your patients. Text messages appear as though they're coming from your organization, and they can be customized to a format and wording of your choice. The formulary also provides access to ORCHA's free Digital Health Academy, which provides bite-sized CPD-accredited training videos on digital health. With auditing and recall capabilities, the formulary provides the infrastructure and governance needed to get digital health technologies to those that need them most, safely and effectively. The patient-facing app library is your organization's site for the public to find safe and assessed health apps for a range of health conditions. The app library only contains those apps that don't require the input from a health or care professional, making sure that users are only accessing apps that they can use independently. Your app library can be delivered in a number of supported languages and only displays app data relevant to the territory that the user is in, making sure that you comply with data governance and residency requirements. Both platforms are highly configurable to meet your organization's key health priorities, as well as the wants and needs of your professionals, patients, and users. The library and formulary can also be configured separately and differently to one another to meet the needs of their targeted audience, and also to support your communication strategy, your health priorities, your governance requirements, and also to drive engagement and successful outcomes. Usability and accessibility are key to the design. Both platforms are rated AA for web content accessibility guidelines and are modern, responsive, and mobile first. The user journey for professionals and the public has been optimized to reduce friction and cognitive load. and to help get safe digital health to those that need it as quickly and seamlessly as possible. The reporting dashboard gives you new population insights. You can see which health apps are being searched for by professionals and the public, which tools they are using, and therefore areas of greatest adoption or need. This exceptional population health analysis and insight can help you to target areas of unmet need and to tailor your health campaigns. With AI-powered search technology, security reinforcements, and auto-scaling to meet high demand, the ORCHA activation product can be deployed to meet the digital health requirements of any size organization.
So I think it's worth reflecting a little bit on why we made the changes that we did. So we recognized that, sorry about that. We recognized at ORCHA that, you know, if you're a time press clinician, what's the difference between 350,000, 1,000, 100, 50, 25, 10? And so because of that, what we wanted to do with the formulary is provide those technologies that were designed to be used in conjunction with a healthcare professional, because that's how you maximize their use, but also because it was those that were most likely to provide the maximum benefit. So it cut out some of the noise that was on our old approach. What we've also done is we've introduced what we refer to as the activation blueprint. So that's working with smaller clinical teams to really understand how digital could be used at different points in the pathway, and then thinking about how we can create protocols and what have you to support the activation of those digital health technologies, but in a way that feels owned by the healthcare professionals within their services, as opposed to just being yet another tool that's made available, but people don't really know how to harness, or worse, don't have the time to harness it. So those are one of the reasons. So we've invested significantly over the last year to improve the look and feel of the digital health formulary and library. The other reason for the digital health formulary is that we know that a patient is 80% more likely to use a digital health app recommended to them by a healthcare professional. So it was really working to reflect some of those dynamics in order to be able to provide that distinction. So the final element of the ORCHA offer, as Tom talked about in the video, is our insights. So we can look at market landscapes, the size, shape and direction of the market, including volume, currency, engagement rates, therapy focus areas and growth, quality insights, published research and trends in usage. I think as part of that insight, it also allows us to identify gaps in existing digital health assessment schemes. So what some of the work that we've done at a global level, for example, we worked really closely with the Mental Health Commission of Canada to create the Canadian Mental Health App Assessment Framework. And that app assessment framework is world leading in its focus on those with lived and living experience of mental health and the development of those apps, but also some of the equality, diversity and inclusion areas. So they wanted to make sure that it was culturally appropriate, giving due regards to their Indigenous populations. And that was an approach that was mirrored in New Zealand as well, who have Titiriti, which is their commitment to providing equitable access to their Maori and Pacifica populations. So it's about taking where there is convergence, but also taking into account what would genuinely move the dial in terms of your use of digital health technology. So it could be clinical outcomes, for example, or patient-reported outcome measures, and it's still an evolving space in that regard. The final bit that I wanted to just mention as well is the level of research that ORCHA undertakes to look at digital health. So, for example, we won an award for how did COVID-19 change how we search for and use health apps. This is a time series analysis of web-based searches for health apps before and after the first COVID lockdown. And that showed that the searches for health apps increased by 343%, and 92% of conditions experienced a significant increase in searches. In terms of preventing healthcare professionals from recommending health apps to patients, it was identified that an NHS stamp of approval was most important, followed by recommendation by peers. Older patients were least likely to be recommended health apps, but that doesn't mean that older patients don't benefit from digital health technologies. Far from it, but if they're not offered it in the first place, we can't yield that benefit. What's also interesting about older patients is they are more likely to follow a structured program. So Chris Wright did some really interesting research. Chris is from NHS Scotland, and he showed how different demographics respond to different types of technologies. So where older patients were more likely to benefit from a structured program that was sort of synchronous in nature, younger people were far more likely to benefit from communication-based technologies, where they could gain that one-on-one support on an ongoing basis. And equally, we did how safe and effective are commonly used health apps for insomnia. So we used a shorted version of the ORCHA baseline review, was used on 19 insomnia apps. 63.2% of apps provided a privacy policy, with just 10.5% demonstrating clinical benefit. And that is why ORCHA do what we do, to make sure that we're able to support you, to identify those technologies, to surface those technologies and make a demonstrable impact to the lives of your patients and your citizens across Northern Ireland, but across the world generally. I'm going to stop there because I realise it's now 20 to 2 and I've been doing a lot of talking. But I hope that that's been useful in giving you a bit of a flavour for the future of digital health apps and how they can be embedded into pathways to relieve some of the pressures facing the NHS today.
Thank you, Fiona. Has anybody any questions? There was a lot of information there. See, Sue's put a note up. I have a question, Fiona. As an avid app user, not necessarily health-related ones, but in relation to what ORCHA do, if I'm a user as a patient and I'm using an app and you guys do a review and find it's not quite cutting it anymore, and you decide that it's maybe going to be removed from the library, how do I know as the end user that actually there's something better on the market now? Maybe I've been discharged, I'm no longer going to see my the person that recommended it to me in the service. So how do I know as the end user that there's a better product to be used?
I think it's a really good point. I mean, from the perspective of the libraries are routinely updated. So when I was talking about those different apps and how they go through periodic re-reviews linked to whether they've updated or they've upgraded, the library will be automatically updated to reflect that. I think that there is, with regards to how then those changes to the libraries are communicated to patients on a more proactive basis, I think that is an example of the activation blueprint in action. It's about thinking how we work in partnership with the relevant health service to issue those proactive communications to alert people to changes to the library, and then sort of targeted individual messages to say to a user, for example, if you've been recommended that product by a healthcare professional and then that product has changed, allowing that functionality, we would then send a message to you to say that the product had been updated, or have you tried, it's been removed from the library, have you looked at this one, or this one?
Okay. And what about clinical risk? So I'm going to use a random one that I know there's a proliferation of apps for: medication reminders. So I recommend this to a number of my patients, and some of them are more compliant than others, but some of them obviously don't even respond to the prompts that come up on their app, and then they fail to adhere to their medication regime. Where does the risk and the liability lie there?
If I've understood your question correctly, you're asking in terms of, you make a recommendation as a healthcare professional to a patient for a medication adherence app, they don't use that app, and therefore where is the risk and where is the liability? Mm-hmm. Is that correct? I think in terms of that again is the partnership between the service. At ORCHA, we couldn't take liability for someone not using an app that's been recommended to them, in the same way that you, I assume, wouldn't take liability for a patient that's not being compliant with their prescription. But what we can do is we can provide very targeted education to make sure that we optimize the messaging to make it as as sort of relevant to that individual as possible to make sure they use it. And I think that that challenge in digital that you've highlighted is not unique to digital. I think it probably extends to the healthcare service as a whole. You'll see that, for example, one of the conversations that Sue and I have, for example, is, well, if someone doesn't use an app, or they don't finish a program, does that mean it hasn't had the benefit? And the simple answer is no, it doesn't. It might mean that they've accessed it once or twice and they get the benefit, but they're not then using it because they've got the benefit they need. That doesn't mean that it hasn't played a role or a purpose. So I think it's about taking that sort of that case by case approach and really working in partnership. And part of the reason why we went forward with the activation blueprint was to explore exactly these issues. I think the other thing to say as well with regards to populations and population health and behaviour change is thinking about how the app library itself is structured. So, for example, if we're recommending an app that's an in-app purchase, how do we make, but then that person can't afford to use that app, then we need to obviously make different alternatives, which is why we've got that search functionality to maximize, from our perspective, the ability for patients and healthcare professionals to find the right app for that particular use case.
Okay. There's just a note in there, Fiona, if you want to have a look at it, from Donna. He's one of our clinical reps and a practicing GP, I should add.
Thank you for an interesting presentation. I mean, yes, I would agree. I think that there obviously is that policy landscape that we need to take into account with regards to digital. I think the reason for highlighting Sleepio as an example was the evidence base, really, and sort of starting to kind of create that rationale for why it would be funded. So the cost benefit analysis. But I do agree that there are opportunity costs in relation to technology and the implementation of technology. And I think in that regard, there's some work that's being done globally about more of that service evaluation perspective. We at ORCHA don't do it, mainly because we try to do this very objective assessment that focuses on information that's publicly available. So the ORCHA baseline review, for example, will be assessed on information that's publicly available. But when you look at service evaluation, so you look at implementation costs, for example, that's more of a one-on-one conversation with the relevant digital health provider, because we're not a vendor management platform in that regard. The other thing as well is that obviously we can't assess that objectively. It could be the ability of the healthcare professional to engage with digital health technology, for example, or some professional resistance to using digital technology, in which case we can work with our systems to overcome it, but we can't assess apps on that basis. Sorry, I'm just trying to keep up with the chat at the same time as answering.
It's just me adding into the comment about how we are from our HFCNI side are using the app library or ORCHA's review process to support some of the work that we do ourselves. And I think Donna is right in that obviously is an opportunity cost, but times whenever we don't have anything else in the toolbox, then it will be just, it's just another tool that we need to use in the right way, in the right setting. It's not the beyond, it's not a substitute, but in terms of enhancing capacity or increasing our capacity or capability, I think when we don't have any more options, then like the pain management, example that was given, when actually increasing prescribing isn't actually going to make a difference anymore. Sometimes then we have to look at what else is in the toolbox in order for us to provide to the patient. So it's not a replacement, but it's just allowing us to have other options, like any tool that we would have.
I think as well, it's about empowering people, isn't it? It's about empowering people with information.
Yeah.
And one of the reasons why this is so relevant is because a lot of this is happening anyway. but it's about how do we enable healthcare systems to benefit from that shift to using digital to help with health and well-being. It's one of the reasons why, for example, with the NORDEC, which is the Nordic Digital Health Evaluation Criteria that we developed in collaboration with Nordic Interoperability Project, that was part of the Nordic 2030 vision, which was really focused on how do you kind of support this shift towards preventative care and not just have a system that's consistently responding to sick care and never really addressing that prevention that could genuinely make the difference in terms of some of those systemic challenges facing healthcare. And one of the reasons we've done that is so that we can assess products to see if they can link in with the healthcare systems used. So obviously there's a huge focus on interoperability, because otherwise that data is just completely siloed from the systems where it would actually make a tangible difference in terms of service improvement, service redesign, recalibration, increasing education of patients and citizens. There was some research that made assumptions about the population's willingness to engage with digital health, particularly for older adults, whereas actually older adults would like to discuss digital health technology solutions, but we're making that decision on their behalf, which kind of reinforces this paternalistic approach almost to healthcare. I think this is as much about empowering and activating patients and citizens as it is about harnessing the benefits of your more sort of classic device type products and technologies.
Okay, thank you. I'm hoping that today has maybe sparked some thoughts with people that have been on the call today about how digital might be another piece in the toolkit. Maybe if we thought a little differently about how we deliver our services, and how we want to engage with the people that use our services as well as delivering them, that you might consider an app as part of that. Please go and have a look at the library and see what you can find that'll maybe spark a discussion at maybe one of your team meetings. I'm putting up the link now for where you can go for the recordings. Again, conscious that you might want to share the presentation and the video that Fiona brought with her today, with those that couldn't make it to the event today. Next month, on the 5th of May, Dan West will be presenting at this event, and we'll be talking about our digital implementation plan and priorities for the next year. Very conscious that there's lots in the press about cuts in funding, etc. So there will be a lot of tightening of belts and still the same demand for services. So the whole prioritization work will be key to how we can continue to sustain services and maybe change how we deliver some of that, perhaps with the use of some of the apps in the library. Thank you again for taking the time out today. And as always, any questions, just drop us a message and we'll happily come back to you. Thank you.
Thank you for having me.